Assalamualaikum and hi everyone. We are from class A for AS12032A. We would like to present about our case study for BIO270, which is type 1 diabetes. Let's get started.
Here are the content: introduction, symptoms and factors, insulin replacement therapy, real-life photos, advantages and disadvantages, conclusion, and references. These are the team members. The first is Farisa Kistina, the second is Nur Amalina, the third is Nur Sorfina, and the fourth is Sharifah Aliyah Diana.
So, for introduction, diabetes is a chronic metabolic disease characterized by elevated levels of blood glucose, which leads over time to serious damage to the heart, blood vessels, eyes, kidneys, and nerves. Type 1 diabetes is less common than type 2. About 5 to 10% of people with diabetes have type 1. Type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, which is a chronic condition in which the pancreas produces little or no insulin by itself.
The symptoms of diabetes. The first are frequent urination, increased thirst, constant hunger, weight loss, vision change, fatigue, and numb hand or feet. Next, the factors of diabetes. The first is insulin resistance. It occurs when cells in muscle, fat, and liver doesn't respond as they should to insulin. This happens probably because of obesity, lack of physical activity, hormone imbalance, and genetic. The second one is pancreatic damage. It is physical damage happen to your pancreas from conditions such as injury and surgery. This able to impact its ability to make insulin. And the last one is autoimmune disease. It happens when your own immune system attacks the insulin producing cells in pancreas.
For insulin replacement therapy also goes by other names, including basal bolus therapy and intensive insulin therapy. Simply put, this is a broad approach that aims to mimic the way our body delivers insulin. Normally, the therapy is for type 1 diabetes patients. However, patients with type 2 diabetes who meet certain criteria are also candidates for intensive insulin therapy. There are type 1 and type 2 definition. For type 1, is an autoimmune disorder in which the immune system destroys the beta cells of the pancreas. For type 2, is characterized by failure of target cells to respond normally to insulin. Insulin is produced but target cells fail to take up glucose from the blood and blood glucose levels remain elevated. Part 1 of how does insulin replacement therapy work. Here, I have provided 5 examples of how does insulin replacement therapy work. First, the amount varies depending on the current sugar levels and the type of insulin used. Second, this involves taking a shot of insulin to balance blood sugar levels in the body. Third, insulin replacement therapy is used to keep blood sugar under control. Fourth, shots are also taken before bedtime to lower blood sugar levels in the morning. And last, insulin is usually taken about 30 minutes before eating to be most effective. Reason why do type 1 diabetics need insulin replacement therapy? To clearly understand the rationale, we need to briefly review some concepts. Insulin is a hormone that helps our cells use sugar, glucose for energy. People who do not have diabetes release insulin in two patterns, background and prandial. The background pattern continuously secretes small amount of insulin. On the other hand, the prandial pattern secretes insulin rapidly, and the amount is dependent on the rise of glucose from food consumption. Now, let's consider this. People who suffer from type 1 diabetes have what medical experts call absolute insulin deficiency. This means that their body makes very little or no insulin at all. For this reason, they need to replace their insulin in a manner that's similar to how our body normally does it. In other words, insulin replacement therapy for people with type 1 diabetes not only provides insulin, but it also tries to deliver the insulin using the normal patterns of secretion. This is where the name basal bolus came from. Basal mimics the background pattern, while bolus mimics the prandial pattern. Part 2 of how does insulin replacement therapy work. These four types vary in onset, peak, and duration. To further explain, here's more information about these differences. First, onset denotes how fast the insulin works right after it's injected. Second, peak refers to the time when the insulin is most helpful in lowering the blood sugar level. Third, duration indicates how long the insulin keeps working in the body. The four types of insulin in basal bolus therapy. There are four types. First, rapid acting, second, short acting, third, intermediate acting, and fourth, long acting. For rapid acting, approximately works 15 minutes after administration, peaks at 1 hour, and lasts for 2 to 4 hours. You often need to inject rapid acting insulin before meals. For short acting, onsets at 30 minutes after administration, peaks at 2 to 3 hours, and lasts for 3 to 6 hours. Just like rapid acting insulin, you need to have short acting insulin before meals. For intermediate acting, approximately works 2 to 4 hours after administration, peaks at 4 to 12 hours, and lasts for 12 to 18 hours. Intermediate acting insulin needs to be administered at the same time each day. Additionally, meals time must also follow a fixed schedule. For long acting, onsets at 1 to several hours after administration, has no peak, and lasts for 24 hours. This is how to administer insulin replacement therapy. There are four how to administer insulin replacement therapy, which is syringe, pen, injector, and pump. For syringe, the method is to draw insulin out of a bottle and inject it into the skin. This is the most common of insulin administration. For pen, another option is to use insulin pens or shots. The pen looks like a regular writing pen, but it has a cartridge that contains insulin. To adjust the dose, you need to turn the dial. One end of the pen has a needle which functions to inject the hormone. Insulin shots are meant for multiple daily doses. For jet injector, this looks like a pen but a larger one. The premise is to make high pressure air to spray insulin to the skin. And last, pump. An insulin pump commonly looks like a small rectangular device that has plastic tubing. On the other end of the tube is a small needle inserted in the skin near the abdomen. You can use an insulin pump to inject a bolus dose of insulin when needed.
This is some of the real photos that we found on internet. Some explanation for these photos is this is a condition that occurs when the immune system mistakenly attacks and destroys healthy body tissue. In people with type 1 diabetes, an infection or another trigger causes the body to mistakenly attack the beta cells in the pancreas that make insulin. The tendency to develop autoimmune disease, including type 1 diabetes, can be inherited from your parents. So next we move to advantage and disadvantage. The first advantage is reduced hypoglycemia. The benefit of nearly normal glycemia in reducing microvascular disease in contentious and complex. Second, better glycemic control in basal bolus regimen. Third, greater mealtime flexibility. And the last one is lower postprandial hypoglycemia. So next, for disadvantage, the first one is higher cost than human insulin. It is because the patient needs to buy the application or machine that costs an arm and a leg. The second one is weight gain. This is because the body begins to absorbing glucose again and converting any excess into fat. If treatment does not manage diabetes well and blood glucose are too high, this can occur the weight gain. The last one, increased risk of hypoglycemia if meal ingestion is low, anorexia, or absorption gastroparesis is delayed.
How to prevent type 1 diabetes? Encourage regular physical activities. Limit sedentary activities, including screen time. Encourage breaks for physical activity during prolonged periods of sittings. Promote at least 60 minutes of moderate vigorous physical activity most days of the week. Encourage a variety of activities that children enjoy, such as sports, dance, swimming, and active play. Second, promote healthy eating. Encourage a balanced and nutritious diet that includes a variety of fruits, vegetables,
whole grain, and lean proteins. Limit the intake of sugary beverage, processed food, and snack in high added sugar and unhealthy fats. Teach children about portion control and the importance of listening to their body's hunger and fullness cue. Lastly, incorporate family-based intervention. Involve the entire family in the adopting healthy lifestyle habits to create a supportive environment. Plan the engage in family activities that promote physical activity such as hiking, biking or playing sports together. Last, model healthy eating habits and positive attitude toward exercise.
Conclusion. To summarize, diabetes is a chronic disease that diagnosed and monitored with blood glucose testing. The symptoms are such as frequent urination and fatigue, while the factors are insulin resistance, pancreatic damage, and autoimmune disease. Insulin replacement therapy, which is also called basal bolus therapy, is one of the initiatives to help patients achieve optimal blood glucose control. The advantages of this therapy are to keep blood sugar under control and prevent diabetes complication. On the other hand, the disadvantages are increased risk of hypoglycemia. Lastly, here are 3 steps that are suggested in order to prevent the diabetes disease, which is encourage regular physical activity, incorporate family-based interventions, and promote healthy eating. Here are the references.
So that's all from us. Thank you for watching. Bye.